Hi. What's happening?
Oh, hey, can you hear me?
Yeah, I can. What would you say is like the overall mood in Chicago? Because I'm in Massachusetts and I'm obviously like in a suburb, so I feel like people are still out and about and like abiding by the rules. People are wearing masks and gloves and like doing the whole thing, but I feel like people are pretty uplifted. I feel like in a city it would be like more melancholy.
Yeah, it's weird because it's like such a lower activity level than usual. Like it's weird in the middle of the day for there like not to be as many cars out. There's not as many people in the train. Um, the bus, they are having people get in the back door instead of the front to like stay away from the drivers, so they're not making anybody pay. Um, and there's like little signs that say stay 6 feet away.
I was going to say, are they enforcing a 6 feet apart rule on public transportation?
Um, they have signs, but I feel like they're not, nobody's really like gonna come tell somebody to switch seats.
What would you say is like the environment, the daily environment at the hospital, or does it change day to day?
It's changing. I think at first it was like the only people that were coming in were people that thought they had coronavirus because everybody else was scared to come in and catch it. It's picking up a little, like we're getting more normal people, but I think the panic has died down a little. Like I think everybody was very on edge and they're starting to relax a little, which is good. When it first started to, especially like they thought if their neighbors had been in California that they were probably going to get it too. But now that they're kind of telling people that they should, even if they think they have it, they should stay home unless they can't breathe, pretty much. Kind of calmed people down.
Yeah. Do you think that's something that people should be following, like stay at home as long as possible?
We're so short on the tests. We're not even testing everybody for it. So I think people are coming in wanting to just know for sure whether they have it and they're not going to. Like, if people aren't sick enough to stay in the hospital, we basically tell them they probably have it and that they should go home and stay away from people until, for 2 weeks or until they don't have a fever or whatever. I would say like back in November, December, January, before any of this really started, we would have, 50 people in the waiting room and people waiting like 8 and 10 hours.
Right.
We don't really ever have more than like 4 or 5 people in the waiting room, and they're not really waiting more than an hour. So that definitely says something about like the volume of people. Definitely not as many drunk people, because usually we get people that like stumble out of the bars or get kicked out of the bars.
What are sort of your main concerns?
So I think, like I was saying too, it's good that people are less panicked about it, because it's not like you can't live every day like in a bubble. But I think that I know, especially in Chicago, as the weather gets warm, I think people are going to be reluctant to keep distancing. And I think especially young people think that they can't get it or that it won't be bad if they get it. And really, it's not true. It's not like pneumonia or the flu. Usually if you're over 60, it puts you in the hospital, and otherwise you're going to be fine. Like coronavirus isn't really like that. I don't know why, but like young people are getting just as sick as old people, and it's scary.
Are there certain things that you see people doing, whether it's in the hospital or during your time out of it, that are either specifically wrong or specifically right? Like anything that you...
Yeah. So, I mean, I think most people I see wearing masks in public, and that's good.
When you see someone not wearing a mask, do you just like want to bang your head against the wall, or like how important is that really?
The masks are important when people are in close contact, and like if you're in the grocery store or interacting with anybody who is not like somebody that you live with, you should have a mask on. If you were taking a walk and you were staying in the open air and like not in close quarters with anybody, then it's kind of like up to you if you want to wear a mask or not. And I think the gloves is a big myth. Like I see people driving in their own cars with gloves on, and it's like, so you put those gloves on in your house, you get in the car with them, you go to the store, you shop with them, you get back in your car. That's worse than if you would just wash your hands when you get to the grocery store, wash your hands when you leave the grocery store.
Mm-hmm. I went for a walk by myself the other day, and I saw these like group of maybe 4 or 5 women, and they all had masks on, and they were all sitting clearly 6 feet apart from one another, like in a parking lot, like, you know, just chatting.
Mm-hmm.
I thought that was really cute. Is that?
I think it's cute. I see people, like people go stand outside the window on the sidewalk and wave to somebody, you know, like I think people have such a hard time not having social interaction, like seeing people and sitting 6 feet apart and wearing masks and being outside is like the way to do it.
Right. And we're hearing, or at least like the 5 minutes of news that I turn on a day, because that's what I limit myself to. You hear, you know, stay inside, stay inside, stay inside. But then you also hear that people's mental health is going to start to be compromised because they're so sheltered. So I think that there is a healthy balance there. I'm not quite sure what it is, but I feel like there's definitely a balance where people don't need to literally be staying inside all day.
Yeah. And yeah, it's true that like suicide completion rates are higher. Like calls to DCFS are higher, domestic violence is higher because people, and those are extreme situations, but like that just goes to show you that people who are already kind of on the edge, like this tips them. Limiting the news is huge. And so much of what is out there is people's opinions. Like there's not a lot of hard science, and the real science changes every day. So I think people limiting the news at all is good. The news is bad enough before all of this, but I think now people have to be really careful about where they're getting their news from. And like, is it a reliable, you know, like just because it's on the internet doesn't mean it's true. The CDC, the World Health Organization, like Johns Hopkins website, like hospital websites,
right?
Things with .org instead of .com. But like, I think it's also what you have to take everything with a grain of salt. Like I've had patients who, I think this has stopped a little, but at first when people were still associating it with like just being in Wuhan, China, people were thinking they could get coronavirus from Chinese food. Which is not true,
that doesn't
obviously.
seem to correlate.
No, so
so what are you doing to take care of yourself?
Yeah, I think this is always true, but now more so. I'm lucky that I have roommates that also are nurses, so I like have people around that get it, and I'm not fully isolated. I've been trying to get outside. Like I think getting even 20 minutes of sun a day helps. Yeah, and especially now, it even, you know, it just like changes your scenery. And I think, you know, I think having hobbies is good. I think everybody is kind of like jumping to like they're getting little embroidery kits on Amazon, or they're like, you know, and I think some people it's very much they're like doing it to put it on social media. But I do think that there's something to be said for like having a hobby other than the TV or the phone, because it's just more sources of stress.
Are you somebody who takes your work home with you? Or do you leave it at the hospital?
I would say I mostly leave it. Sometimes if I have a rough shift or like a complicated situation, it'll affect me. But I think in general, I try to kind of like take a minute and like shut it off when I leave. Yeah. Because it's too much otherwise.
Yeah, it can definitely be overwhelming. And if you're somebody who does bring your work home with you, I would imagine that in the current climate, it wouldn't be very healthy.
Yeah. And, you know, a lot of people with coronavirus are not that sick, but a lot of people are just really sick and it happens really fast and they're young and it kind of comes out of nowhere.
Right. Are the people of Chicago doing a recognition at night like I've seen in New York and Miami?
Yeah, downtown there's people like yelling they like yell and clap or whatever on their
Yeah.
balconies
And
at 8.
does that affect you and whoever you're working with if you are able to hear that, or if you're outside and you see it?
Yeah, I think people really like it. And a lot of people, like people with kids or like doctors with kids, have been bringing in like little thank you notes from kids. All of that. I mean, it helps, for people to recognize that like we're putting ourselves at risk.
Right.
For sure.
Yeah.
Yeah. And I think people just expressing gratitude is enough, like it doesn't, it's not to say it has to be like monetary or like that you have to be donating food, just like telling somebody that you're grateful or like, doing your part to not be spreading it. Obviously it's worse right now, but we all put our lives at risk all the time, like even before coronavirus. I mean, the flu is less likely to kill you, but like we could get tuberculosis will kill you, or like a needle stick, or, somebody comes in and is combative or confused and they punch you in the face. So it's like it's more constant now, but we all the time are putting our lives at risk. So on the one hand, it's like nice that people are grateful, but it's what we all signed up for. And I think it's going to be interesting to see if people still appreciate us when coronavirus is like,
settling
put away or
whatever,
settled,
right?
or
Hopefully they do.
Yeah. And if they make a vaccine, everybody should get it.
Well, all we can do is really just continue to see how it plays out and wear our masks and wash our hands.
Yeah. And I think the one other thing that people have to be reminded of is like that people can have it and not have symptoms. And during that time you can be spreading it.
Yeah. Right.
Like somebody asked me hypothetically the other day, like, could they go to see their parents? And I was like, and this again, it's like, it's a personal decision, but it's like, a person could have it and they could go see their parents and then realize 4 days later that they have it and then their parents have caught it, or vice versa. And then like, you just never know how, like, it's like, you've all seen one more person, and that's the problem.
Cause I was thinking of that too. And I feel like with that, the unknowing of whether or not you have it or not I just don't think it's worth it.
Yeah. And that's what I think too. And, it's everybody's decision to make on their own. But I know that I would feel so guilty if somebody I knew or like a friend of a friend of a friend got it, like if the chain could be traced back to me, I wouldn't forgive myself for that. So.
Right. Yeah. That's the exact same thing that I was thinking when I was mulling over whether or not I was going to go home to Florida. Well, I appreciate you before and after Corona.
Thank you.
Please stay safe, and thank all of your colleagues for me.
I will. Thanks for chatting.
I'll talk to you soon.
Okay.